Hi, my name is Anaí, and I'll be teaching you the proper way to apply any cold or hot compress on the patient. So in this case, I do not have the proper equipment or a patient, so I'll be performing this task on myself. I'll try to the best of my ability to explain it verbally. So I'll explain what measures you have to do. So before you get started, you always want to make sure to do the proper hand hygiene. Super important. Hand hygiene, first thing to do. Always first thing to do. Super important. Once you've done the proper hand hygiene, you want to go ahead and provide privacy for the patient and identify the patient. You want to ask the patient for their name and birthday and confirm, and you want to check their wristband. Once you've done the following, you want to go ahead and get started. So for example, for a cold compress, you want to go ahead and introduce yourself to the patient. Greet the patient in a nice way. You want to let them know that you'll be applying a cold compress on them and the reasons why you are doing so. You want to check your care plan and see the order requested. So if the health provider requested to put on a cold compress on the patient, you want to check the following: how long the patient should have it on for. You want to check where the patient will be, where it will be placed, what kind of compress will be placed, the temperature of it. All of those things are important. So I'll be performing the task on my hand. So for example, let's say you are using a cold compress. You want to always put a barrier in between that person's arm and the cold compress. So usually you'll grab like a towel or something that could protect the person's skin. So I'll use this plate as an example of my barrier. So then you would want to go ahead and grab the cold compress. The cold compress will be on top. You want to secure it so it could be on the arm. You want to go ahead and tape it up, or you could tie it up. So in this case, I'll use this as an example. I'm so sorry about the circumstances. So you'll want to go ahead and tie this around the patient's arm and secure it tightly. Tightly, but not to the point where it is causing the patient any type of pain, but pretty snug, so it could stay on there for a while. So you want to go check in on the compress frequently. You want to change the compress at least once per every shift. You want to check on the compress every 10 to 15 minutes to see if there's any reaction to it. You want to observe if probably the skin is getting irritated, or is there anything unusual in the skin, so you could report to the nurse at once. Now I'll be telling you what to do if you are applying a hot compress. So same thing, you want to provide a barrier in between the skin. Super important. For, let's say if it's electrical hot compress, there will usually be wires. You want to make sure the wires you want to make sure the wires are aligned, and when they are not tangled up, you want to make sure they are properly straightened out. You want to put the hot compress on top of the barrier, and you once again want to either tape the compress or tie up the compress. Super important. So once you are done, you want to make sure to come and check frequently. You want to check frequently for the temperature. You want to make sure there's a proper temperature that was requested. You want to ask the patient. It's super important to ask the patient, is the temperature okay? If it's not causing them any pain, if it's too hot, too cold for the patient, you want to make sure to fix it and adjust it. You want to do observations and report anything to the nurse if you see any irritation, and anything unusual that needs to be told to the nurse at once. So that is basically it. I hope I explained it the best of my ability. Thank you.